Question 1. A 55-year-old female presents with a gradual onset of shoulder pain and restricted movement over the past 6 months. She reports difficulty with overhead activities and putting on clothes. What is the most likely diagnosis? Correct answer, B. Adhesive capsulitis. Question 2. A 60-year-old male complains of shoulder pain that worsens at night and difficulty lifting his arm above his head. An MRI shows a full-thickness tear of the supraspinatus tendon. What is the initial management strategy? Correct answer, B. Conservative management with physical therapy. Question 3. A 22-year-old college football player presents with a history of recurrent shoulder dislocations after a traumatic incident during a game. What type of instability is most likely? Correct answer, B. Anterior. Question 4. A 30-year-old baseball pitcher complains of shoulder pain and a sensation of catching during overhead throwing. What is the most likely diagnosis? Correct answer, B. Slap tear. Question 5. A 35-year-old swimmer presents with shoulder pain and noticeable scapular winging during arm elevation. What is the most likely cause? Correct answer, B. Scapular dyskinesis. Question 6. A 40-year-old male presents with shoulder pain following a fall directly onto his shoulder. He has a noticeable deformity over the acromioclavicular joint. What type of injury is most likely? Correct answer, C. AC joint sprain. Question 7. A 70-year-old female presents with chronic shoulder pain, stiffness, and crepitus during movement. X-rays show joint space narrowing and osteophytes. What is the most likely diagnosis? Correct answer, C. Glenohumeral osteoarthritis. Question 8. A 45-year-old office worker reports shoulder pain aggravated by overhead activities and reaching behind the back. The Neer and Hawkins-Kennedy tests are positive. What is the most likely diagnosis? Correct answer, B. Subacromial impingement syndrome. Question 9. A 50-year-old male is 4 weeks postoperative from a rotator cuff repair. What is the primary focus of his rehabilitation at this stage? Correct answer, B. Passive range of motion, ROM, exercises. Question 10. A 28-year-old tennis player is undergoing rehabilitation for a slap tear. Which exercise should be avoided in the early stages of rehabilitation? Correct answer, B. Biceps curls. Question 11. A 19-year-old volleyball player with multidirectional shoulder instability is beginning a rehabilitation program. What is the primary focus? Correct answer, B. Strengthening dynamic stabilizers. Question 12. A 55-year-old patient presents with shoulder pain and a partial rotator cuff tear. The patient has a history of hypercholesterolemia and diabetes. What intrinsic factors could have contributed to the pathology? Correct answer, C. Tendon degeneration due to systemic conditions. Question 13. A 40-year-old patient presents with shoulder pain and scapular winging. The winging worsens with arm elevation. Which neurological condition is most likely contributing to the scapular winging? Correct answer, C. Long thoracic nerve palsy. Question 14. A 68-year-old patient is 6 weeks post-total shoulder arthroplasty, TSA. What is the primary focus of rehabilitation at this stage? Correct answer, B. Active assisted range of motion, ROM, exercises. Question 15. A 65-year-old male presents with shoulder pain that is constant, worsens at night, and is unrelieved by rest. He also reports unintentional weight loss over the past 2 months. What should be the clinician's next step? Correct answer, C. Order imaging and refer for further evaluation. Question 16. A 30-year-old weightlifter reports shoulder pain during bench press exercises, especially during the lowering phase. He has a history of posterior shoulder dislocation. What condition is most likely? Correct answer, B. Posterior instability. Question 17. A 35-year-old baseball pitcher complains of a deep, aching shoulder pain that worsens with overhead activities. The patient also reports occasional clicking and popping. Which diagnostic test is most likely to confirm a slap tear? Correct answer, B. O'Brien's test. Question 18. A 55-year-old patient with a full-thickness rotator cuff tear is beginning rehabilitation after 6 weeks of immobilization. What is the next appropriate step in rehabilitation? Correct answer, B. Start active range of motion, AROM, exercises. Question 19. A 25-year-old swimmer presents with scapular dyskinesis and shoulder pain. Which exercise should be emphasized in the rehabilitation program? Correct answer, B. Scapular retraction exercises. Question 20. A 30-year-old patient is 8 weeks postoperative from a SLAP repair. What is the appropriate focus of rehabilitation at this stage? Correct answer, C. Progress to active strengthening exercises.